The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic surgery after massive weight loss. With the lap band and gastric bypass becoming so popular, these patients are left with very loose skin. Well, with us, we have a world-renowned expert on the topic, Dr. Hurwitz. Dr. Hurwitz, welcome to the program.
Nice to be here, Randy. Thank you.
All right, we say this at the top of the show, but literally you are known by every plastic surgeon that I've talked to, knowing that you are coming on the show. Everybody's heard of you. And your book, The Total Body Lift. And so you call it a body lift, right?
Yes, I do.
That we're talking about. What defines a body lift?
A body lift means we're working in a cosmetic way in both the upper body and lower body. We leave no areas out. We're going to take care of arms, breasts, the waist, the abdomen, thighs. It's a body lift.
Now, what's changed in the last, from the first time you did a body lift to now? We talked on the phone, you say that you're a lot better as far as results. I mean, what are you doing now that you weren't doing back then?
Well, when I was first faced with a challenge of body lift surgery, I applied what I knew. Breast surgery, abdominoplasty, but I didn't know how to put it all together. And then there were areas like the back, the waist, even the armpit, we had no answers for. But there were big problems, and I had to figure out how to take care of it.
All right.
So I know how to take care of these patients now. The techniques have been worked out. I've been doing it dozens and dozens of times. And on top of that, I'm better preparing our patients for surgery. We understand the proper nutrition, the proper health patterns we need, and how to take care of them afterwards. So a lot has changed over the last 12 years.
What are the age ranges of the patients that are coming in for body lifting?
Well, I can have them as late teens, from 18, 19 years old, into their 60s, and do this type of extensive surgery. But most often we see people, women and men in their 30s and 40s, when they get a whole new lease on life.
Yeah, now, with these patients, of course, they went in to lose the weight, whether it's a lap band or gastric bypass, but you say that there's a new set of problems.
Oh, yes.
That they get.
These patients can be very disappointed, in fact, upset that they've traded a full body, an oversized body, with curves and natural looks for sagging skin. It could smell pretty bad, particularly under the armpits or under the groin area. And they're disgusted with themselves. Many of them are deeply depressed.
So let's talk about a little bit about your technique and the photos and what you're doing. In fact, I'm looking at the most dramatic one you have right here, and if our cameras could zip on this patient right here, okay, that overhang. Tell me a little bit about what you're doing to do that.
Well, we have a large area of excess skin that extends from the belly button over the hips onto the thighs. And I need to pick it up, isolate it, draw out the areas I want to remove, and take it out and put together the tissues that are left behind, and leave a wonderful female shape. Quite a challenge. Now, we leave a scar around the belt-like area of the body, but there's a small price to pay for a whole new shape and removing this tremendous impediment to life.
You say you want to give women curves again. You want to give them a feminine characteristic.
Yes, this isn't just about cutting away loose skin and getting a tight result. Too many plastic surgeons think so. What we need to do is build up the fullness areas on the hips and the buttock area that are so characteristic of women, narrow the waist down, and of course fill their breasts up. And so it's a feminine figure we're going after, and it's possible in these rather distorted images.
Yeah, and even the afters, which are even a little bit hard to look at, but in clothing, this must look fantastic, obviously.
Well,
I mean, a huge difference. They probably can't even wear tight clothing in the befores.
Oh, these women are tired of wearing tennis outfits, overalls and sweatsuits. These clothes just fall off of them. And so, frankly, an imperative is to make them shapely enough to wear proper garments. And it makes a big difference.
So you brought some photos. What are we looking at?
Yes. I'm very proud of the work I've done and demonstrated in the book. But more recently, we have patients like you see here, Randy, that the top layer shows the before. This woman felt she had a shapeless body. She had fullness around the lower abdomen that hung down like a weight.
Now, this is not as dramatic as some of these others. This is what you call a mommy makeover?
No, she is a mommy, but she had lost over 150 pounds.
Okay.
And what you can do with a woman like this is come up with a very attractive figure. Even though there's extensive excess skin, you'll notice around the belly button and below, she's really quite broad, and her breasts are hanging very low. And
her arms are big.
Her arms are quite big. And afterwards, she ends up with a narrow torso, a shapely figure, a narrow waist, well-formed hips, and the breasts in a proper position, and of course, smaller arms. In any view you take a look at, this is a very shapely, model-like form. This woman, after getting her changes from me, her life changed dramatically.
Like what? What do they say?
Well, in her particular case, not only was she happy how she looked, she was in a most unpleasant relationship, and she had the courage of her convictions to drop that
to get out of it
and move forward in life. And life is that much better, and she's able to direct her own destiny.
So they've had it. I mean, by the time they're going to do a body lift, they've just can't take it anymore.
They're upset. Many are depressed. Many are mobilized by this. They're not socializing. They're not happy with their partner. They're not happy with their life at all. This is an unusual opportunity for a plastic surgeon like myself to make a real difference in women's lives.
Do you recommend they read your book first?
I think it's very important to read the book. It's very educational. Not only do they get some vignettes of what I think should be done and the techniques, but the book is full of testimonials of women and men who've gone through the very same surgeries they're contemplating. Finally, the book has the risks involved. The very important problems and complications that can occur and that we need to be aware of.
Okay, now you call it, on this MD News magazine, that you not only reshaping bodies, you're reshaping lives.
There's no question about it.
You see big changes after it's done? Do they tell you? Do they call you? Do they send you notes?
It's usually proportional. The more significant the change, the more dramatic their lives change. I'm impressed of the great impact I'm able to have in reshaping these women and reshaping their lives. And they're eternally grateful to me, and they express it in many ways. Several of them have recently gotten married, and I've been invited to their weddings, and what could be better?
Is that right? Now, do you do this in one procedure? Because you're doing, I guess, the arms, you're doing the torso, you're doing the abdomen, you're doing, their legs, their buttocks. 2 surgeries, 1 surgery?
Usually it's in 2 operations. We do the lower body first, the waist, the hips, the buttocks, thighs, make sure they heal for 3 or 4 months and no complications or done with that, and then do the upper body. It gives us the opportunity to trim up the lower body in case of other issues. So
how soon can they go in for the second operation, if everything goes well?
Usually 3 months. I want to get any chance for infection or healing problems to be over with. They have to build up their blood count because you do lose blood during this. As far as not doing this surgery, I've come from a reconstructive surgery background. I rebuild bodies, breasts, legs after amputations, injuries. This fits right into this because this is a marriage between aesthetic surgery and reconstructive surgery. So I'm used to long, hard, tedious operations, using the tissues at hand and building bodies up.
So they travel all over the country and out of the country to see you?
Oh, yes. I'm very pleased to see them. We are well organized to receive patients. We have an international airport in Pittsburgh. And that's where I prefer to see them.
Because lap band, is mainstream now.
There's no question about it. There's over 100,000 operations being done each and every year. So we have a well-sprung...
Is that right?
Huge number in this country. And frankly, with the economy improving and people thinking about spending the money to take care of themselves, we're seeing a huge number of patients presenting themselves with
But there's a secondary problem with all these weight loss surgeries. What are you going to do with all the loose skin?
Yeah, the loose skin is a dreadful problem, and I'm in a wonderful position to deal with that. But it's not just the loose skin. I get a chance to rebuild these bodies, to shape them. The men look more like men, and the women have the curvaceous body of women in most instances.
Okay, now you're going to send out some books, some free books. If they book a consult with you, you're going to give them a free book. They can get your book, or they can order it online. They go to your website?
You can order online, Amazon.com. It's out there. But frankly, if you see the program and you want to go forward and get a consultation, we'll waive the usual fees as well as the cost of the book and send it to you.
Okay. And what are their fears, by the way? Or let's start there. Not the fears, but the frequently asked questions. So they go in, do they always think that they're unusual, that you've never seen anything like their situation?
Well, frankly, everyone has their unique story. The complexity of what it took to get as big as they were, what they went through to lose the weight, what medical problems they had, and the reaction to it. Some women are desperately upset about their breasts, and others, the same problem, they're worried about the thighs. So everyone, of course, is very individual, and I have to analyze their situation and come up with a plan.
Do they all want to pretty much know what they're going to look like the after? And that's hard to tell them, but what do you just show them your other photos?
Well, it does help a lot that I have lots of experience and I have many patients who've allowed me to show their photographs to give them a sense of what they could look like. But frankly, most of my work is in sitting right in front of a mirror as I push around the skin and the other tissues, and I shape them as best I can right in front of a mirror. And we get a pretty good idea of where we're heading.
Okay, let's take a look at some more of these photos.
Well, I have another woman here who is a little heavier than what we saw before.
Oh my goodness.
This lady is a lovely person, and really one of her major problems was clothes just did not fit her properly. They hung off of her. She couldn't wear anything tight, nothing to reveal any of her sensual figure. She wanted to change, and she needed her breasts fuller and higher so she could wear a bra properly and not rub her wrong.
So are you doing a breast augmentation, breast lift, or it depends on the person?
Oh, we sometimes use breast implants, but so many of these patients have plenty of tissue, if not in her breast, along the sides of her chest. And I'm an originator of taking that excess skin, instead of just throwing it away, I'll put it and build up their breasts very safely. It's natural. They can't reject it. It can't get hard. It's always soft and in good position. And I'll do the same for their buttock area. It can be flat and loose, and we'll fill it up with those tissues there.
So with this woman's buttocks, and I'm not sure if I could show these on the show. They'll have to go to the website to see the nude photos here. But this woman's butt is completely transformed. I mean, what are you doing there? I could see a light incision.
Yeah, as most people ask about questions, of course, scars come up. These pictures show what we see most often. The scars fade very nicely. It's often hard to tell.
Is that a butt lift? Is that what that's called?
That's a Brazilian butt lift. We take off the big, heavy hips and pull up the lower butt, and up it comes in position.
Okay, now this next photo, what are we looking at over here? This is...
This is another, I think, artistic issue. She had very little fullness in the upper part of her body and bottom heavy. She needed breast implants, 325 cc implants, and reshaping of the breasts, and removal of.
And this abdomen that's common. Is that these people have this look?
Yeah, the abdomens are very difficult. This is not your everyday abdominoplasty. By and large, we do remove the skin between the belly.
So what you're saying, it's not a typical tummy tuck. I mean, the technique is a lot different from a regular tummy tuck?
No question about it. The technique is a lot different.
Okay.
We have to take out more skin. We have to take out extra fat that you normally wouldn't have to do with a tummy tuck. And then you got these ridges and depressions that need to be removed and smoothed out. Sometimes to help it along, we'll take out a little corset excess in the middle and leave a scar in the middle where many women already have scars, as you see in this last picture here. So the waist is drawn in. The scar is still healing. It'll fade away very nicely.
But in clothing, I mean, this person now is going to look great.
Oh, it's phenomenal.
Compared to the way it was.
She had
But it looks like an old body before, by the way.
Well,
like a 70, 80-year-old body in the before.
Well, these women tell me that they don't want to look like their grandmothers, and they do. And they certainly, it's lights out at night, and it's lights on now with the bodies that we reshape.
Now, when it's all done, by the way, do you find that they become more active? I mean, they become it gives them leverage to exercise more, to eat even better?
Well, I would prefer to have patients who exercise greatly right into the operating room as far as I'm concerned, but their social lives are dramatically different. As a rule, they become extroverted and seek out others, and they're able to leave their support groups with people like themselves and move on to the regular society and join in a very meaningful and enjoyable way.
Is this a 6 or 8 hour operation?
Yes, this operation, the stage, if it's a total body lift or separate stages, a minimum of 6 hours, can be up to 10 hours.
Are you turning them around? I mean, are you turning them over in the surgery, or they stay on one side?
Most patients are turned. So we put them asleep under general anesthesia and then turn them onto their stomach, do the work on their back, their buttock area, their back rolls, finish that, turn them over, re-prep, re-drape, start again.
Is that right? Tell me a little bit about the arms. We're going to take a quick break, but the arms. What's the technique for arms?
The arms can be the most dramatic aspect and the most disabling. They not only look bad, but they can flap. These women in the hottest of weather wear garments that just totally cover from their wrists to their shoulders. And along with the arms, I discovered that the armpit is incredibly deep and deformed looking. So it's like taking a big sail and reefing it up, cutting out the extra, and leaving a scar on the inner aspect of their arm so that you barely can see it. But the scar, and where I made an advance, goes across the armpit onto the chest, and we just reshape that part of the body along with the arm, integrating it finally into the chest and into the breast. You get a concept that the arm stands by itself as a problem, but needs to be integrated with the rest of the body, as does everything else.
And what of all areas of the body? Okay, you're doing a Brazilian butt lift. I'm giving a recap here, like a Brazilian butt lift. You're taking care of the back, the arms, the breasts, and the abdomen. But it's not your typical tummy tuck. This could be, a complete. Is there anything we're leaving out here? I mean,
where plastic surgeons tend to lose their effectiveness is in the mid-torso, getting that waist narrow, getting the breasts picked up and stay there, and getting rid of all the folds. This is the most difficult and new aspects, and routinely we deal with it, and I think we deal with it very effectively.
Okay, great. Now we have time for a few more photos.
This woman here didn't lose a lot of weight. She just didn't have a very good figure, and in fact, her breasts are very asymmetrical. The right side barely exists, the left side is small, and her abdomen is too full and no good waistline. By a combination of liposuction, a mini tummy tuck, so I don't touch the belly button, and putting in implants in a very sophisticated way, I could even her out, shape her up, and frankly, Randy, give her a figure that a model would be envious of.
So this is a mommy makeover?
Absolutely.
So?
This is a mommy makeover, starting with a woman who really didn't have much to work with to begin with. But she's finished with her pregnancies and quite pleased.
Now, by the way, because of your experience, I mean, you get people that have lost 200 pounds, 250 pounds. So the typical mommy makeover for you is pretty easy, probably. Like somebody with a little bit of an overhang and...
Well, I
mean, is that true or no?
The goals are so much higher when you deal with someone who's just had the changes after pregnancy. We're aiming, as a rule, for a model-like figure, a figure they once had or maybe only dreamed about.
Okay.
So the stakes are higher, and the challenge is greater as a rule. And so to create a waist where there never was one, to get rid of the stretch marks and redness of the abdomen and the sagging breasts, so the benchmark is very high. And I think I'll give you an example.
Okay.
So this lady, she has a figure beforehand that most women would be very accepting of, but not she. Her breasts are flat and sagging and lost much of the volume they had before she was breastfed. Her abdomen is loose, particularly you can see it below the belly button and over the pubic area, and she has some full hips but almost no waist. By tightening her up, doing an abdominoplasty, shaping her breasts with what we call a mastopexy, bringing the nipple up, and I might add, with as few scars as possible. Her whole breast was reshaped only with a scar around the nipple area. There are no more scars you can see in any of the pictures.
Is that right? So you could do a breast lift without that scar down the middle?
She doesn't need an anchor scar. She doesn't need a vertical scar. Whenever possible, that can be avoided by carefully reshaping the inside of the breast and carefully putting in the right size implant.
So mommy makeover is becoming very popular. I mean, do they actually call it mommy makeover?
It's been referred to that way, but frankly, I've been in practice for over 30 years now, and there's a new social phenomena. Women in their 40s, 45, don't want to look like their mothers looked at that time. They know what they did before, looked like before. They're not accepting of that, and they know that comprehensive plastic surgery can be very effective and very safely done. They just got to find the right surgeon.
Okay.
They're just not accepting.
Do you feel that you're at the top of your game? I mean, you're very proud of what you do. We talked on the telephone.
Oh, I really do, Randy. It takes a while to get the experience to analyze and to be able to do what I do. And I really feel like I'm on top of my game. God willing, I'll have the health and the well-being to continue this as long as there are women who wish to have this done. And I'm looking forward to many, many years.
So, physicians will watch this show. Bariatric surgeons will watch this show. We'll have it all over our website, wellnesshour.com, on YouTube. What do you want them to know about what you're doing?
Well, I'm one of a few plastic surgeons who've really devoted to this effort and have taken the time and effort to present my work in peer-reviewed forums, whether it's in lectureships or in journals, in book chapters. And I have legions of patients that are very pleased.
So it's all about results.
Absolutely.
You feel better results.
At my conference this morning at USC, the bottom line was, you show the best results I've ever seen, said a number of the participants. And when I hear that from other plastic surgeons, I just feel like I have to go forward and keep it up.
What if somebody says, but Randy, I don't know if I want to fly to Pittsburgh. There's got to be somebody out here in...
Well, actually, I actually have a secondary office in Beverly Hills I share with Dr. Jay Calvert. And I did surgery this week here, as I've done from time to time.
So you fly back and forth?
Okay. I do. For special situations, I'll fly back and forth. My first preference is in Pittsburgh, but I have a lot of people on the West Coast, and we're able to do surgery here in the center of Beverly Hills.
Can somebody be too far gone, by the way, for the body lift, for the total body lift? Have you ever seen it?
I haven't seen a skin issue I can't deal with. They may have medical issues that make it so that we want to go very gently and maybe just do a tummy tuck. Say they have diabetes that are difficult to control, or high blood pressure. But no, there's no one out there that I can't deal with if it's the first time around. Now, some patients, and I see increasing numbers, have had surgery that wasn't well performed, and tissues have been removed and scars have been left behind that are just about impossible to do much with. But I'm willing to take it on if there's anything I can possibly do.
And you can fix some of those things.
I certainly can fix some of them, and I need to. It's a case-by-case kind of analysis.
Okay. Now this question about, so they've lost the 200 pounds and they've reached their goal, let's say. How soon should they see somebody like you or see you?
You lose your weight, keep it stable, about 4 months, and then we should be talking.
But earlier treatment's better, obviously, like anything else.
Well, I think so. I think so that there's nothing to be gained by waiting longer. You can be contacting the office because it takes several months to get an appointment for me. And so
you're that busy, huh?
Oh, well, business is good, I must say.
Okay.
But I'm busy in part because we're getting the word out. My website explains a lot. This show is very informative, and that's why I wanted to be here, to get the word out, because I want to spread this to more people. And I have proteges working with me that help me take on the load.
All right. Good for you. And by the way, when you do this alone? I mean, obviously you have an anesthesiologist. You're in your OR. Do you routinely have another plastic surgeon there with you learning this?
Not only learning it, I routinely have a team. I have several physician assistants that operate with me and take care of some of the issues. I have another surgeon working with me. We can't do this comprehensive body lift surgery in 5-6 hours without having good help. But I'm supervising every aspect, and it's under my responsibility.
So you really like this. I mean, you really like this total body lift.
I myself feel like rebirth, like I'm reborn in plastic surgery.
Really?
This is the most exciting time of my career, which has spanned 3 decades. I'm able to intervene in women's and men's lives in such an effective, special manner that I've never experienced before. The response, the gratification I receive is the most magnificent that a man could hope to have.
So in 30 years, in all areas of plastic surgery, this is the happiest group of patients. Is that right?
Without a doubt.
Really?
As a group. Sure, there's some people that remain disappointed and are hard to please. We know about that. But as a rule, I look forward to seeing each one of them. I take them through their journey in a stage or two and move them on to the next level of life and their gratitude. And you'll see testimonials on my website. Their gratitude is the most extraordinary. I just love it, and I don't want to give it up.
Are you getting better all the time? I mean, is there that much more to go?
without question, I'm getting better because each individual has their own issues of exactly how to mesh. I'll come up with 2 or 3 plans I prioritize based on what they want to go through, how much they wish to invest in their body, and you never know for sure exactly what's the best plan, exactly what to do. So there's an excitement, I must say. It's a little bit like going to the track, a little more sure. You want to bet a sure thing, but there's an excitement and an invigoration. And I must say, the ability to build up women's breasts or fill out their buttocks in a way that is socially acceptable and attractive, I got the biggest kick.
And they get to feel pretty again and sexy.
Maybe they get to feel pretty for the first time.
Is that right? Did they tell you that?
Absolutely. And their lives change. What I can do for women's lives, I didn't have that power in the past, and I'm routinely able to do it today.
We've talked about women, but men, are they less likely to come in? Are you finding that, because I guess there's an equal amount getting the surgery,
more women are getting the bariatric surgery, and women carry more weight under their skin, and so when they lose that weight, the skin sags more.
Oh, I see. Okay.
In proportion to men. But I see about 20% of my patients are men because I'm well known.
Tummy tucks? I mean, you're doing these major...
Tummy tucks, but they have these hanging areas above the breast area.
And the armpits, pretty bad?
Armpits, arms, even the thighs, and the love handles are just huge. So yeah, I see men, and they're just as pleased with the results. And so they're a little less likely to come to the table like women because our society is so female-oriented toward aesthetics. But these men come and they are very excited.
So it's worth the trip to go to your center, get your book. That's a good place to start. I mean, anybody, in fact, even if they're considering weight loss surgery, yeah, they should probably read the book to find out what they are going to have to deal with after the surgery.
Go to my website. There's a lot of information there. You can get a consult through the website. We can do an internet-based consult with photographs over the telephone.
Is that right? Okay, good.
Get the ball rolling. You don't have to come to Pittsburgh, but we would like to see you at one of my offices before surgery, approve everything, and then let's do it.
All right, good. I want to thank you for coming on the show. Great stuff. Great information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to watch this interview again online, we'll have it on our website. It's under body lifting. It's the only one. Just put in body lift or put in Dr. Hurwitz's name, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.